And there was a huge study, sundowner study. I can't remember what it's called, but physicians are basically supposed to recommend 7 days, I think it's 7 days a week of 30 minutes of brisk walking where you're not gabbing to a girlfriend, you're trying to walk pretty fast in the hopes that patients will do it 6 days a week. I think that's 5 to 6 days a week of 30 minutes. And it was as effective as antidepressants for mild to moderate depression.
Thanks so much for joining today, Dr. McMonagle. You actually inspired me pretty early on in terms of ozone therapy because we would do these ozone therapy trainings and often you would speak and you just had very visceral and just a lot of experience around ozone in terms of helping people get better with it. And it was just inspiring. There wasn't a lot of doctors that I was listening to at the time. So I found it really helpful to hear all the stuff that you were doing. But just as we were just talking, you were saying that you're trying to kind of transform your practice a little bit and trying to transform how you educate patients in terms of healthcare versus sick care. What did you kind of mean by that?
Well, we've always been a preventative health clinic, but I find we're getting a lot of messages out there about sort of Band-Aid treatments. And I'm trying to figure out how can we reach more people talking about being more proactive. So how do we shift into more healthcare and not sick care? And so it's so many things. And sometimes it's so easy, just decent nutrition, hydration, minimizing pain, increasing energy, snowballs to such better health. And it's very achievable and it's not very expensive. And so just trying to be able to make that relatable for people of here's some things you can ask your doctors about. Do they do these treatments? What would it cost? What kind of timeline would I expect to feel better and what % improvement? Is it a year from now? Should I feel better in a couple of weeks? And I think those things are really important to have an understanding about how soon you can feel better.
Yeah. I mean, I've always kind of harped on that, healthcare is relative, obviously it has its levels of complexity and things. I've just started doing some lab work and stuff with Dr. Mandy LaGreca, and she's really a whiz on that stuff. She's just going way over my head on it. But yeah, Dr. LaGreca is just going through all this stuff and it's very complex, right? All the different things she's going through. She's giving me custom nutrition based on all that kind of stuff. But the general concept of being healthy is being in good community, drinking good water, eating good food, exercising appropriately.
Mm-hmm.
Why do you think we have such a deficit with those things, despite them being very simple concepts to embrace?
I think back about Dr. Doug Lisle, who wrote The Pleasure Trap. So when I was in school, it was a water fasting clinic and they came to teach a weekend class or a short course. And there was a lot of resistance in my class, which I thought was interesting, but he was talking about the pleasure trap. So we're going for concentrated fat, salt, sugar. So we want those dopamine hits. We want those quick fixes. And so this is human nature. So I do this analogy that I'm not the best at analogies, but I talk about, so let's say you were a caveman and you didn't know what food was. And somehow you magically realized you need to eat something, however that comes about, your instincts. And you see this bed of spinach and you grab some spinach leaves and you're not dead after you eat them. And you wake up the next day and you're okay. Well, then you see this bright red raspberry bush and it looks more enticing and you eat some and it's super sweet. And you're like, oh, your brain tells you, I'm going to go for those raspberries over that spinach. Well, then the next day, an ice cream truck comes by and gives you some ice cream and your brain is on fire. It's like, oh my gosh, I just got concentrated fat, salt, sugar all at once. Forget the spinach, forget the raspberries. I'm going to eat ice cream anytime I can. So we're just conditioned to do that. So I feel like our patients understand when they're educated a bit about what their brain chemistry is doing to them, it's kind of more forgivable. And then we educate them, how do we start getting away from the concentrated fat, salt, sugar? how do we start moving more? How do we decrease that pain and inflammation? So just some basic science to explain, the food industry has marketed very heavy to us. They're very smart. They have a lot of money for marketing. So of course we're going to reach for those things. So I think Dr. Lyle was a good inspiration early in my career about how do you make those good decisions when you're tired, when you're in pain? You want to reach for those things. And that's one of the first things that I talk to patients about is how do we start switching those cravings into more whole foods? That's, I think, one really important tool.
So how do you do that?
So basically introducing the idea that you can eat real food pretty easily. It doesn't actually take more time to prepare than getting something to go. Trying to do simple things like filling up with, I tell them just go back to like a simple plate theory and you try to eat left to right and you eat the vegetables first. So try to stimulate those stretch receptors to tell your brain that you're full. So eat that salad first before you reach for the crackers and hummus or the chips and salsa. So you're trying to eat those whole foods first. And over time, you're rewiring your brain so that your cravings start to change. So those things are really helpful. I think sort of before patients are really able to take that in, I find I need to give them something quicker to get them feeling better. So where Western medicine might use pharmaceuticals to get them out of pain, physical, mental, whatever, I might use ozone therapy to improve energy, decrease pain. And now patients are listening to me more. Okay, I feel better. What did you ask me to do? I have more energy. Wait, you want me to start making a meal every day, or you want me to walk 30 minutes every day? So if we have really safe tools to improve quality of life, then I find that snowballs into being more willing to do other things, if that makes sense.
Yeah, 100%. I mean, if I'm going to you to solve a problem and you can show me that you're capable of solving it, so by making me feel better, I'm going to assume that you're going to be able to take me down the rest of the journey of feeling, all the way better. So I think that's really valuable if you're like going into a clinic and you're sick, and some of those tools. Are there any tools that you would give to people to make them feel better that they could just do at home for free, or just things that they can do that don't necessarily require going into a clinic? Obviously going into a clinic, if you can do it, is the best way,
Right.
even just as a preventative care. And that's why like I do labs and that kind of stuff. It's just prevention, because we all got like messed up genes or some sort of gene expression of something, or something's deficient in our diet or whatever. But
right.
Yeah.
Well, I think as far as, so sure, plenty, but maybe one of the first things would be finding a physician who will listen to what your concerns are. And the patient's usually right. So a doctor who'll take a good history, and then just doing some thorough blood work that can be mostly covered by insurance. But if you're vitamin D deficient, or you're iron deficient, or your thyroid's horrible, it's going to be really hard to create change at home for free. So there's some pretty basic labs that you can just rule out some significant things.
Sure.
So, and a lot of those basic labs aren't being done. That's what's wild to me. I don't know why vitamin D isn't a standard screening test. So most insurance companies won't even pay for it anymore. And they mark up a $30 to $50 test to be $350. So it makes no sense to me. So some basic labs, and then what's causing you pain? Is it anxiety? Is it digestion? Is it body pain? Is it fatigue? I mean, these are some of the main ones, right? So I give a lot of tools for home use, but usually after they come in for some treatments to start feeling better, so I can guide them better. An initial evaluation really helps me understand what the hindrance is to improvement.
So I know you kind of said you don't know why those basic evaluations aren't done, but do you have any inkling of why those might be avoided? Because if like I don't know, just going on the 80-20 rule, and if you really are super vitamin D deficient, well, that's going to solve a lot of other stuff. So it would make sense to look at that, right? So
Right.
Missing some big things like that seems like it would have some pretty major gaps.
Yeah. Yeah. It's unfortunate, right? Some basic screening tools are really helpful. Yeah. Why is that not happening? I mean, I used to order vitamin D all the time when I was first in practice, and it was always covered by insurance. It was so easy. And now every time I order vitamin D, it gets denied. I have to add more codes. It gets denied. I add more codes, and sometimes it gets accepted. And sometimes a patient has a $350 bill from their insurance company. It doesn't really make any sense. So, and you can find cash labs online, but then what I find happens is patients bring me in all these labs that are mostly not necessary. Thousands of dollars of testing that they've ordered online instead of some really basic ones that could be really inexpensive. So we can help patients navigate, insurance labs, cash labs, and how to make the best choices. A lot of people lately I find are coming in with, they bought supplements online, they've seen on Instagram, or they've purchased a bunch of labs that they've seen on Instagram and stuff. And some of them are helpful, but they're spending quite a bit of money on maybe some unnecessary testing and maybe just some really good marketing. So it may not even be a good test at all anyway. So I think the biggest thing is finding someone who can help you navigate through all of this. We're kind of in a time of information overload and very censored information in many ways. So I think if you can find a healthcare provider who will help you navigate all of this and then continue to help you maintain this at home. And so you're not coming in very often. My patients don't come in very often. They might come in a few times at the beginning and then maybe once or twice a year. It's a really bad entrepreneurial model, but that's the goal, is that, I'm then a resource when they need me. And otherwise they've learned a lot and they come in periodically. That's what I hope for.
So going and finding a doctor, I think, is really wise, but then it begs the question of like, who's a good doctor, and does this guy actually know how to help me?
Right.
There's a lot of trust involved with that, because you're spending a lot of money and a lot of time, and it's somewhat it's not super invasive, but a little bit. So you've traveled around and you've talked to a lot of different doctors, and a lot of different doctors. Like, when you meet a doctor, you're like, this guy gets it, or it's just with it, helps their whoever it is. What are some of the, like, how can people find a good doctor?
So I go to tons of conferences, as you know. I'm sort of obsessed with, I was laughing that people make that joke about FOMO, of fear of missing out, like hanging out with friends, and mine's FOMO about conferences and knowledge, especially about like ozone and platelets and stuff, PRP. One, I guess it would be, have they been in practice for a while? That's helpful. Looking at some reviews online, that's helpful. I think an initial appointment is just asking questions of, with your recommendations, how long would you expect improvement to take? What should I expect? People often don't ask that. So what % improvement in this amount of time could I expect with my joint pain or my fatigue? And then, are you buying these huge packages at the beginning of a visit? That's kind of a red flag for me. Packages can be helpful. They take less employee time, it's less bookkeeping time, and there's some benefits to that on the admin side, so doctors can offer less expensive treatments. But at the beginning, if you're leaving spending thousands of dollars, that's a red flag for me. So I'd say you ask friends who they've had a good experience with, you read some reviews, and your first visit, you're not dropping thousands of dollars, and you're asking specific questions. In your experience, what do you see? What timeline do you see for improvement? Those are really reasonable to me. Does that answer your question?
Yeah, I think so. And as I've like hired and worked more with people, I've come to value just like the relatability and genuineness of the person I'm talking to, are like two things I have to check off my box. Like, and I think for just people that you work with, that just makes the communication gap so much easier, and there's a lot of value to be had there as well.
For sure.
I kind of have a side question. What are some of your favorite conferences to go to?
Well, I love all the ozone conferences for sure. I can't help it. I love ozone therapy conferences. I like AAEM conference, the environmental medicine conference. That one's really good to go to.
What do you learn there?
So I have an environmental health undergrad degree background with chemistry. And so I did environmental health stuff in Peace Corps. So I've always kind of leaned towards more environmental medicine as well. And that conference I really like. I think in medicine, we don't talk enough about environmental medicine and health, and it's so huge.
I don't even like understand the underpinnings of that. Like when you say environmental health, I understand like, yeah, there's the environment, there's mold toxicity. I often associate that with EMFs too, because I think that's become a lot more common to talk about. And could you just explain what your understanding of it, like what is the scope of environmental health? What does that mean?
Yeah. So, well, for this or that organization, and then in general. So, when I think of environmental health, environmental medicine, so I think of environmental health of, health of our environment. So more water, air quality, that kind of thing. When I think of environmental medicine, I think of things like educating us on toxins in the environment and how they affect us, because we can't necessarily see or taste them. So are they affecting our health? How do we accurately test for them? A lot of people are dealing with mold issues, things like that, but there's a lot of misinformation too. So what testing works to test for mold? If it's in your urine, doesn't mean that you're actually having a problem with it. It could be from food, and it could be causing minimal health impacts to none. Or are you creating antibodies to it? So it might be you've moved into a house from the 70s and you had no idea there was water damage, and your whole family since you've moved in has had congestion. One guy recently has cats getting sick since he moved into this duplex, and that was what helped him understand what was happening. So he's getting sick, all these sinus issues. He noticed his cat was getting sick. And so people don't understand how much where we're sleeping and living can affect our health. Chemicals that we put all over our skin. So I've had patients that use common brand name body lotions with fancy packaging, and it's giving them rashes, and they don't want to stop using it because they like the way it smells. So educating people on how to switch out cosmetics to be not containing lead, organic cosmetics, websites for that, cleaning up home air quality, so many things. And we're not necessarily talking about that. Buying organic food, and does that really matter? Is it worth paying more, and trying to educate people on that? It's a big disconnect. I have patients doing 150,000 kitchen remodel, but organic food's too expensive. So I think it gets back to what I was saying before this was, I want to get people before they feel the pain. So if you're doing 150,000 kitchen remodel and you're not buying organically grown food, you're not feeling enough pain yet in your life to create those changes. But I want to create those changes before people have all the health conditions, right? So nice. Environmental medicine, it's so important, and not talked about much.
Have you looked at ewg.org before? That has like that. What do you think of that and the ratings they use?
Yeah, there's that, and there's actually a lot of websites now. I think all of those are a good start. So there's one I have on my phone. I think it's called Talk Dirty.
Interesting app.
I think I know, right? I think that one I haven't used it much because there's certain companies that I just buy from. I can't find it right now. I have too many apps on my phone, but yeah, I think that one. And then and I just tell patients, like, you don't necessarily have to throw out everything in your house if that's overwhelming, but every time you're getting something new, so you run out of some toxic cleaner, just start switching things out. So you can make stuff if that's overwhelming. You can buy stuff now almost anywhere, and now it's almost the same cost. So we just start slowly switching out what we're exposed to. I think the hard thing is we're often not feeling immediate change, right? So if I take a pill and I get a pretty quick change, that gets my attention. If I'm switching out cleaning products and I'm switching out cosmetics, you're not necessarily getting immediate change, right? So
And
it's
you might never notice it either,
you might
because when
never
you
notice it.
slowly change,
Yeah.
it's just like the frog in boiling water.
Yes.
So we have this nootropic supplement I was messing with a little bit, and it's been like shown to regrow gray matter in the brain and do some like really crazy stuff,
Mhm.
but it takes like 60 to 90 days to have
Yeah.
some effects. And I'm not working with it anymore because it was too much of a pain to get people to, one, to convince people. It's a very flooded market, like
Yeah.
nootropics in general. But the other side of it is like, well, how is it a nootropic if I don't have like an immediate boost? And it's
Yeah.
like, it's more about the long term. So
Yep. For sure. For sure. Yeah.
so there's, yeah, just a ton of crap. I mean, I'm staying at Airbnb right now, looking around at like the different things and just trying to identify, like, how do I identify things that probably don't belong in my home or would have a healthier alternative?
Well, an easy one that I tell people for everything when they go grocery shopping, cleaning shopping, whatever, is if there's a label and you can't pronounce everything on the label, don't buy it. That's that's the very beginning. So that's so simple. So food, ideally, you're not buying food that has a label on it anyway. And if it does, if there's coloring agents that have been banned in many countries as a carcinogen, maybe don't get that. If you're buying candy, get the candy that doesn't have high fructose corn syrup and food coloring, and just start switching that stuff out to better quality products. And you'll find you eat less of that stuff too. And then you can still give your kids the treats, but you keep switching those things out. So for home cleaning products, very simple ingredients can clean your home. And so that's all that's under my sink at my office and at my home is I don't use the other stuff. And it gets to a point when you clean that stuff up, it seems like you're much more sensitive when you're around it. So like if I walk through a mall, which I so rarely do, if I have to get to my car and go through like the perfume area, it is so overwhelming to me.
Yeah,
It's so
I know.
toxic smelling,
It's,
and I can get a slight headache pretty quick. I don't remember that happening in high school. Like I'd be in the mall walking through that stuff. It didn't faze me. So is that detox pathways not working as well? Is it more bioaccumulation of junk that I'm more sensitive to things? Is it because I've cleaned up my environment and I'm more sensitive to things? It's probably all of those.
it is interesting, like how you do become more sensitive to it, because I've noticed that too. It kind of too much information, but I haven't like shampooed in like over 10 years. I haven't like, don't use a lot of stuff in general, especially like cologne and whatnot. But yeah, like smelling cologne and perfume smells like chemicals to me now. It doesn't have
Yeah.
like attractive scent to it. Or what was it? My wife, she gave me like an ice cream bar
Yeah.
last night, and it tasted, it was like a lower calorie one, so it's probably filled with a bunch of junk, and it just tasted like bad. It's like,
Yeah.
this is not like, I feel like I may as well be eating like a plastic container like,
Right.
not quite, but it's just,
Yeah.
yeah, you do develop new sensitivities towards that.
Yeah. Some of those common, fruit smoothie franchisee places, if I have a sip of one, I'm just like, oh, that tastes disgusting. It just doesn't taste like real food to me. So your cravings and your palate changes when you're eating cleaner, and same with your environment. It makes sense when you transition to those things, and it doesn't have to be overwhelming or expensive. You just slowly start doing it.
So you mentioned you use some simple cleaners. What do you use?
So well, I'm in Oregon, so we have access to stuff in the stores all over the place, but I think almost everywhere now does too. So I'll often use hydrogen peroxide,
Yeah.
and I'll just spray hydrogen peroxide on counters. I'll often use water. I mean, like I'll wipe counters off with water. But there's different like orange citrus cleaners that are super basic, that have vinegar in them, white vinegar. So I used to make them when I was in med school and super broke, but I tend to buy them last minute now, but they're
Yeah, the
really,
luxuries.
I know, natural cleaners. So I tend to buy a few different ones just at the, different co-ops around me. And when I look at prices, they're really the same as the other ones. I mean, sometimes it's less expensive to get the more caustic ones, but you can also dilute stuff too. You don't have to use it at full strength. So you can make it pretty cost effective.
Yeah. It's kind of interesting because I always used to, and I think it's kind of a common thought process, but like that the skin is basically like the shield against the environment. But it's, I don't know, like what was it? Steroid cream withdrawal started to tip me off a lot more on like just how much of a systemic reality
Yeah.
the skin has. So when you're exposing yourself to like chemicals or breathing it, like you're absorbing way more than you realize. And
Yeah.
with like genetic expression, you can start to change how your genes are being utilized and all that kind of stuff. So I don't know. It just kind of sucks that it's so easily accessible, I guess, just to be able to get access to this stuff that is not good for you.
Yeah.
So
I mean, our skin is our biggest organ of detoxification, right? So, we need to sweat and we need to not put chemicals all over our skin that absorbs. So I tell people, if you're really attached to your Chanel number 5, that was the other day, then just at least spray it on the clothes and not directly on your skin, just to help minimize impact, right? And maybe don't do it when you're really not needing to, if you're really attached to one scent. So you can minimize exposure at the very least, but trying to get away from it's really helpful. And it just brings back activity is so important because you got to sweat, you got to detox with sweat. So if you're in too much pain, maybe you do sauna for a while and shower afterwards until you can start exercising more.
are there like scents or like deodorants or perfumes that are natural that are not just like basic chemical base?
Yeah, so there's a lot of different, like vanilla and different essential oil, roll-on perfumes that are really nice.
Okay.
Or sprays, so you can do essential oils. There's a lot of deodorants now that don't have aluminum in them. I've yet to find, there's a couple brands that, like there's Lumi is a newer one. I haven't looked at all the ingredients, but it seems to work a little bit better. I've used ozone oil deodorants. There's I haven't found any that work the same as just the standard super toxic deodorants as far as an antiperspirant goes, right? So if I'm lecturing all day and I just know I'm going to be in front of a lot of people, I might use a super toxic deodorant.
Yeah.
But I try not to use much of it. And then outside of that, I'll use natural deodorants. And sometimes you just have to apply them more frequently. But you could maybe minimize exposure as much as you can. There was just some recent research article coming out about aluminum and dementias. So, we've got aluminum in all our baking soda. So all our baked goods has
Really?
aluminum in it. Yeah.
I didn't know that.
Yeah.
Why is it in there?
There's a movie called Injecting Aluminum that I've had for like 6 years and I haven't finished it yet because it's a little bit depressing, but apparently I'm going to get some of the stats wrong, but I think there's 2 baking soda companies vying for the main contract for baking soda. And one used aluminum and one didn't in the processing. So fact check me here, because I've watched it a while ago. And it sounded like the one that used aluminum had more marketing dollars, and so they won the contract. And so you can buy organic baking soda that doesn't have aluminum, but there's no way that that's in all the baked goods, right? So, and then they use mercury to make high fructose corn syrup. So, think about how much baked goods and corn syrup kids are getting right now. So in an individual serving, is it within allowable limits as a metal that we're exposed to? Yes, if we accept those rules. But cumulative, all this fructose corn syrup and baked goods that people are eating now, processed food that we have access to, that's a lot that we're getting exposed to. So I just had someone not that long ago, she had said she eats a lot of tuna fish. So I thought to order a blood mercury test, which I don't usually do because blood mercury and lead has to be like pretty high recent exposure to show up. And she had elevated mercury levels. That would have never shown up at a typical doctor's office, right? So she stopped eating as much tuna fish and now her mercury levels are come crashing down. So her digestion's better since then, but I don't know if that's connected or not. But what would have happened 10 years from now, we don't know. We don't have a crystal ball, but we've got to keep cleaning up things in our environment, basically.
Yeah. And it's tough because there's like the convenience. I think the part that's hardest for me is like not the discipline. I mean, it is discipline, but it's a convenience factor, like just being, and a lot of people are so busy, and we have 4 kids now. So like giving them packaged foods, like and it'll say organic on it, but I know it's still garbage. Like it really is.
Less garbage, but still garbage.
Yeah, they did that for me to make me not feel as bad. They know the psychographics, they know who they're selling it to, and it's pretty much the same companies that make all the other stuff. I mean, there's probably some good ones out there too, so I don't want to make them all sound bad. But have you, like, I don't know, you probably advise parents too. How do you advise them on just like feeding their kids in a way that's, I don't know, that you don't see it as an obstacle to like time or like just not like a burden, but is there like a mindset that you give them or just advice?
Well, I'll never forget one of my, when I first started my practice, I was an independent contractor in a chiropractic clinic. And during an office meeting, this newer chiropractor was there with her 2 kids. And they were sitting in the corner eating celery and carrot sticks. And then the other 2 kids were running around the clinic eating the Jelly Bellies from the counter, this free Jelly Belly machine, which I thought was very interesting to have in a health clinic, like food coloring candy. And now, I mean, that's one example. But it's, why are kids menus at restaurants hot dogs and chicken nugget? I mean, like, it doesn't make any sense. Like, why isn't it the same as the adult menu, but a smaller portion? It makes no sense to me. I've never understood that. So I found that the parents who introduce whole foods at the very beginning and they have whole foods in the house, it's much easier, right? So it's hard when some parents, the kids are going to birthday parties and they're like, I'm not going to eat that. That has food coloring in it. Or mommy says that's toxic, so it gets hard too when it's like a time or a place. But if in your home is whole foods and prepping whole foods, then the impact of going to birthday parties and all of that is not as bad.
Yeah.
I mean, everybody's going to eat stuff that's not perfect.
Yeah. No, that's what I appreciate that you said. Sometimes I put on antiperspirant because it's like, I still like cookies and stuff. And I'm, I think it's being moderated within that is kind of the key to longevity. But yeah, it's funny you said going to the birthday party and saying that's toxic. That reminds me of my daughter, because a lot of times, like when I don't feel in the mood for giving a full response, because we've had the discussion a lot of times, and she did early on eat like really, really clean because she had some skin issues early on, some eczema that and things like that. So she ate all whole foods pretty much the first 2 years of her life, and that was it, which was great. And it was all like fresh and that kind of thing. But when I don't feel like giving a response, I'll just say like because of cancer or something like that. And so it's just kind of an easy way. So I could totally see her going somewhere and saying telling them they'll get cancer.
Well, and what did Michael Pollan's books, that he talks about eating whole foods and stuff. One of his quotes that I read was something like, if you're going to eat dessert, just make it at home so it has less bad stuff in it, basically, is the gist of it. So at least if you're using ingredients you have at the home, you're not going to be probably dumping in all these binders and fillers and food coloring, right? Because you don't usually have that stuff at your home when you're baking your own dessert. The other thing I think about is that the research on we can only make so many decisions in a day. And that to me is very interesting. So I tell my patients, if I've had a really stressful day, last minute add-ons of patients with acute conditions, maybe an employee couldn't make it, we're understaffed, whatever. Maybe I didn't get enough sleep the night before, whatever, like it's been a stressful day. Then if I don't go straight home after the gym to have food that I already have at home, if I go to the grocery store, I know I'm going to make a less good decision. So I might leave with the organic rice crackers, but it's still, so it's maybe not Doritos with MSG and food coloring, but it's still not really a health food, right? It's still processed on some level. So I might leave with chips and hummus and organic wine or something, and not Doritos and glyphosate filled wine, but I'm still not making as good of decisions as if I go directly to my house that I already have food there, right? So I try to talk to patients, if you can minimize the amount of decisions you make in a day, it really helps. So what are the things that are causing you stress, and how do you minimize those? Like reevaluating your goals. Are you getting to sleep on time? Like just all the basic health stuff, you can start making better decisions.
Yeah. And you can also take decisions out of the equation to a degree by like, when I'm done with work, this is what I'm going to do. This is what I'm going to make. This is what I'm going to buy, and like kind of premeditate it to a degree.
Yeah.
I find that to be really helpful.
Mm-hmm.
Or like when we used to be in a really tight budget, like going to the store, if it wasn't on our list, we were allowed to buy it. We actually had to come back a different time and rebuy it, even if it was something we like needed. Like just because like it forces you to like just habitually kind of pre-plan everything, and then we were able to budget it out and that kind of stuff. But I think decision fatigue, that's right on the money, because that's what I struggle with. Because at the end of the day, it's like I don't really want to be I'm so mentally exhausted. It's tough to be like, I'm going to spend another hour and a half, 2 hours, like really cooking up something nice now.
Well, and it can be so simple. I mean, a salad takes minutes. And I think so, like what I see a lot in my patients is like, I don't have time to exercise, but it can be 15 minutes. I can't afford a gym membership, but it can be at home. But if you're stressed and tired, you want to kind of check out, right? So I just try to get people to create some lifestyle habits where they do something 3 or 5 times in a row, and then it just starts to become part of the routine. So like I exercise every day after work. It's a way for me to let go of the day. But if you ask me, do you go to the gym? Do you work out? It doesn't even really register. It takes me a minute to be like, oh yeah, I do. Because it's just so part of my day that I don't think about it. So like my gym clothes are always in my car to change at work. If I come home first and I have a full kind of CrossFit gym in my shop and all kinds of gadgets, I'm less likely to use those, because once I'm home, I'm like, oh, I'll just do this first. I'll do this first. And next thing you know, it didn't happen. I'll do it tomorrow. But so I tell my patients, well, if you're at work, change into your gym clothes, do something on the way home, or do it at lunch, or do it before work, and just do it the same time every single day. So just creating those healthy habits and patterns are super helpful, I find. And making it fun. Like if it's something you don't like doing, find something else. So it might be team sports, it might be classes, it might be, you can find something that works for you. But that nutrition, exercise, sleep, hydration is so basic, the foundations, and it's so important.
Yeah. And I agree on like those subtle cues that are helpful, because like I'm not wearing a collar today, so this is a bad example, but a lot of the times I'll be working out of a different place or at home or somewhere, right? But I'll still, even though I don't have to, usually I'm wearing a collar. And the reason for that is because like the separation between like home and what is like a comfortable environment or like distraction essentially from
Mhm.
my job. Like I need a cue like that tells me like it's work time. And then when I take it off as well, then I know it's time to like be with family or do whatever. And so like a lot of those subtle cues can be
Yeah.
like, I find to be really helpful.
Yeah.
And it's because like, yeah, if you come home, your default is to do what you do at home, not what
Mhm.
you do at the gym.
Mhm.
So
Yeah. Yeah. And there's easy. So I'll often, um, I'll do lately, I've been doing a lot of sit to stand tests with my patients.
what's
Uh,
that?
so it's a test. So it really is reflective of mortality rates. So if you look up sit to stand test, so you basically sit on the ground and you try to stand up without using your hands or arms. And some of my patients can't do it. And then you have points if different points if you have to use both arms or how you have to what you have to use to get up. And so you can score yourself and then you can say, okay, your goal in the next month is let's work on some exercises so that you can go from sitting on the ground to standing up without using your arms. Um, those things, patients are laughing, they're having a good time usually, unless they have a lot of pain. I mean, if they have too much pain, I'm not doing it to make them fail. I don't do it, but
Right,
I say this is our
right.
goal, right? But we might talk about how do we improve dorsiflexion of your ankle? How do we improve your glute muscles? How do we improve your upper body strength? And so I'll demo exercises in the treatment room and I'll prescribe them very specific set of exercises. I'll demo like how to foam roll, how to use bands for a workout, things that might cost you $100 that you could have all of that stuff at home to do. And just make it relatable, doable, right? You could do incline push-ups off your kitchen counter. I mean, there's so many things you can do because I have a lot of patients that they're too embarrassed, nervous, shy to go to the gym until they get more fit first. And I didn't realize that was happening with a lot of my patients. So we'll try to do things that they can do at home so they start building confidence, right? So sit to stand test is a great one to have people be able to do. And just make it an achievable goal. And we all should be able to do that. I'm quite confident you can do that.
Yeah. Yeah, I think so. Yeah, that's too bad that they feel just like they can't go to the gym because it's like supposed to be the place that you get healthy,
Yeah.
or one of the places, right?
Yeah.
So yeah, that's kind of a shame that there's that expectation that we set on ourselves.
And
So
there was a huge study, sundowner study. I can't remember what it's called, but physicians are basically supposed to recommend 7 days, I think it's 7 days a week of 30 minutes of brisk walking where you're not gabbing to a girlfriend, you're trying to walk pretty fast in the hopes that patients will do it 6 days a week. I think that's 5 to 6 days a week of 30 minutes. And it was as effective as antidepressants for mild to moderate depression. It just took a little bit longer to kick in, but then it was actually more effective. So just moving, right? So people say like, well, it's raining, it's cold out. Like we always have reasons why we're not doing something. So when you're sick enough, you'll figure out how to do it, but then it's harder to do those things. So the idea is we've got to move and eat better before we get too sick to do it.
yeah. So what is the patient base that you're primarily seeing? Like, what are the issues that you're generally working with? 'Cause you
So
covered physical therapy in there too, it sounded
yeah, yeah.
like.
I mean, I talk about nutrition and exercise with probably every patient of mine ad nauseum. They probably get
That's
tired
great.
of it.
That's great though.
I'm sure they get quite tired of it. And my poor staff is like, sometimes they'll be in the kitchen, like hiding what they're eating, or they'll send me photos of what they're eating for dinner. It's pretty funny. So lots of perimenopause treatment. So using bioidentical hormones, testosterone for low testosterone and botanicals and bioidentical hormones, women, and not doing these crazy dosages that I see out there. But balancing hormones can really help with mental clarity, joint pain, hot flashes, night sweats, libido, brain fog, all of that. And putting in nutrition with that, super helpful. So hormone stuff, we do tons of gut work. So, SIBO, IBS, all the gut stuff, because that very much impacts our immune system and our mental health with neurotransmitters, right? So I do a lot of that. And then we work with a lot of athletes and a lot of musculoskeletal injuries. So doing a lot of ozone injections and PRP injections, systemic ozone treatments for endurance, athletic recovery, less sore after you work out, more exercise stamina, and lots of chronic fatigue, chronic infection, chronic illness work. We're only going to see more autoimmune disease, chronic fatigue issues, gut issues, skin issues. I mean, you look at the trends of chronic disease, they're massively increasing. So we see all of that. So we use ozone really heavily in the practice. It's probably my favorite tool. And then we use pharmaceuticals as needed, but more of a backup plan. A lot of nutrition education, a lot of plant-based medicine, nutraceuticals that are good dosing, good quality, so they actually work. Just guidance on what people are doing and how to simplify their life. I don't want people doing, piles of supplements. It doesn't make any sense to me. I always tell people, like, they might bring in a bag of stuff, and I just tell them, I could justify a room full of supplements based on science for you, but that's not reasonable. So let's do some fertilizer to the soil, something that you could do consistently so we can track progress, but not this smattering of supplements that you take here and there, and mostly you just stare at and feel guilty for not taking them. So trying to simplify people's lives, basically. What else do I see a lot of? A lot of skin conditions, especially in younger kids now. So a lot of rashes, acne, lots of acne, rosacea, that kind of stuff.
Mm-hmm. On the bioidentical hormone, well, first of all, with it's like hormonal replacement, right? Or a supplement. When do you decide that you want to put somebody on a hormone that's from outside the body? Versus try to get them back on the right track without that? Yeah,
that's a great question. So let's say, let's say you're 55-year-old female. So this would be pretty common, 52-year-old female, and you're getting 10 to 15 hot flashes per day and 3 to 4 night sweats per night. You're waking up drenched. You can't get back to sleep. You're really tired, you're getting more and more brain fog, you have a lot of joint aches and pains, and you feel horrible. Then usually botanical medicine, nutrition changes is not going to be quite enough. If you have 2 to 4 hot flashes per day, 1 to 2 night sweats per night, then we can usually modulate that perfectly fine for quality of life with nutrition changes, herbs, nutraceuticals. And so my goal is not to have people on hormones for the rest of their lives, but to basically get symptom management and improvement of quality of life.
So
now,
it is temporary.
What's that?
It is temporary typically.
Yeah, some women really like the skin rejuvenation aspects, the anti-aging aspects. So we might keep them on a little bit longer, but at lower dosages. They don't need to be super high dosages. And we look at, family history, risk, and do some blood work. But just based on what they're telling me, I can tell, are we going to likely need bioidentical hormones, or is botanical medicine enough? And often it is. It's quite powerful if you're using the right kind of stuff.
How do I boost testosterone with botanicals?
Yeah, so that's a good question. So what's interesting is, so when I was first in practice, I don't know, almost 18 years ago, I would check. Well, I almost never had men in their 30s complaining of erectile dysfunction or low libido.
I've been hearing that all the time from doctors lately.
Yeah, and I'm testing first morning blood draws for testosterone. Men in their 30s, they're like 285, 385 for a testosterone. it should be like 800.
Yeah.
So I'm seeing that consistently. So every once in a while, I'll see a man in his 70s and his testosterone is 750. That is super rare. If you look at some other parts in the world, testosterone levels are significantly higher in older men. So we have to think about neuroendocrine disruptors. So all these things in our environment that are affecting our hormone levels. So you've got to work on minimizing plastics in your environment, doing all these things, right? So in the meantime, we might do some botanicals to improve libido, or we might do some different hormone therapy while we're trying to improve your environment. But if we jump the gun and put you on testosterone and we're not cleaning things up, it's like I just gave you a big piece of chocolate cake and you don't want to do all that other stuff, right? So I've got to, if I give you too good of a treatment too soon, you're not going to do all the work that it takes to clean up why this is happening. Does that make sense? So it's,
100%.
so it's really, it's maybe a disservice for these like men's clinics that are doing all this marketing online about, you know, do you want to have this good libido? Here, you can take this. And I have patients who are getting testosterone prescribed online, injecting these crazy dosages, not managing their estrogen levels after that. And they might have a really high libido, but they're not healthy. And so we have to be really careful about that. So, you know, are there reasons why if you're a lot older and your testosterone is lower that we would do testosterone or herbs without all the other stuff? Sure. But when you're younger and it's happening, that gets my attention as, you know, why is your testosterone so low? One of the best things to do is start lifting weights and building muscle mass. So that alone can improve your testosterone levels. So, and nutrition.
Yeah. Yeah. And you have to be sleeping good to do that too.
Yep.
Yeah, I just forgot my follow-up question. But well, I had another good question off that. I can't remember what it was now, but yeah, so with the do you call it TRT? Is that what you would call it, or is that a totally different thing?
Yeah, testosterone replacement therapy. Yeah.
Yeah. So is that something that you would wean people off of that as well, or do they have to do it indefinitely?
I guess it depends what they're doing. So, you know, if you give someone young testosterone injections, it can lead to testicular atrophy and infertility issues. So, you should be educated about it if you're going to do it as a physician and as a patient. If you're older, like in your 70s and your testosterone's low and we're doing injections, I'm going to keep working on other healthy things to, you know, other things to work on for your health. But yeah, you might do it indefinitely.
Okay.
Yeah.
I'll hit you up when I hit my 70s and you'll get me all
Yeah.
juiced. So we'll just get jacked.
Yes.
Yeah. Oh, I remember. So my friend Tom Seeger, he owns Morosco Forge, which is an ice bath company, and he got into it just a number of things. But he actually, I don't know if you have any experience with cold exposure and testosterone. He raised his testosterone from like 6 something up to 1100, which is nuts. And he's 52, 53. Somewhere in there. But he had done a lot of lifestyle changes before that. So he's like mostly keto, cleaned up a lot of the environmental factors and that kind of thing. So I'm sure that helped with it. Do you have any experience with that or any knowledge about that?
I've had patients get improvements with hair loss, fatigue, hormone levels with doing cold therapy. I always forget to recommend it because I hate being cold, but I know it can be so good for you. I can't wrap my head around personally doing it, but I totally do recommend it for people. I try to do everything that I recommend, but that's one that it's hard for me to do. But yeah, there's definitely improvements with that.
Yeah. So I think some people just have I have an affinity for it. Like when I decide to do it, I don't, I'm in Florida right now, so I don't have access because I have an ice bath at home and I keep it at 33, 32 and a half. So it's like chock full of ice. And so I actually look forward to getting in and doing it though. But I also have like conditioned this reward cycle from it because you get so much of like a dopamine and norepinephrine and that kind of stuff from doing it. And then but yeah, the thought process is, because there was it wasn't like, I don't think an all-inclusive study, but there's a lot of things indicating its effect on testosterone. And, science is always lagging behind like
Mhm.
kind of anecdotes. And then there's kind of the next level of science, which is like, we're making some observations and it's not quite
Mhm.
objective yet, but it's giving some indications on what to look at. They did two groups of people, of cyclists, or they're just athletes. Maybe they just did the cycling as the exercise, but they had one group do the cycling, like a 20-minute cycling session, and then do an ice bath. And then another group did the ice bath and then a 20-minute cycling session. And the people who did the exercise afterwards had like a really significant, I can't remember what it was, increase in testosterone over time. And it like
Mhm.
seemed like it maintained for a while as well.
Yeah,
So,
that's really
and
cool.
yeah, it's kind of interesting. It seems kind of counterintuitive how something, but there's so many of those like basic things that can be
Yeah.
really helpful, like heat, cold, like
Yeah.
saunas, right?
Yeah.
Hypothermia and some of that stuff is even used in cancers. And
Yeah.
like, I don't know, there's something to that.
Hyperthermia treatment for cancer is awesome. I refer patients, you can't get the temperature you need in the United States, but for hyperthermia treatments, and I've had several patients improve. My father, when he was alive, he was at some point had been diagnosed with lung cancer. He'd smoked since his 20s and he was like 80 something. And he did hyperthermia treatments and it arrested his lung cancer until he died years later of heart attack.
Wow.
It's amazing. And I've sent several patients with breast cancer up there. That's kind of one thing I like to do is be a resource for people because I've gone, like you've met all these people, you've gone to all these conferences. So you're a really good resource. So helping people navigate where to get second opinions and treatment options, even if it's treatments that I don't do, that I really enjoy doing that. Yeah, I was going to say I did last week a BFR treatment. Have you heard of that? The blood flow
Yeah,
restriction
I
exercise.
actually have my set here somewhere.
Do you?
Yeah.
And that really got my attention. So the ones I used are a little bit more narrow. So I just, did on arms and upper legs, right? And I probably did with a chiropractor who really focuses on them, 15 to 20 minutes of like a nothing workout. I mean, some step ups with arm raises with a light kettlebell, some planks, hardly anything. So I would never be sore from that. And I was a little sore in many places that I don't normally get sore for days. And I didn't have to thrash my joints and, thrash
Yeah.
myself to do it. So all of these things are super cool. And then there's some research on improving bone density with BFR, right? So elderly can just walk doing it and improve bone density. So those are the kind of things, or power plates. So I have a power plate at home and I do that, and that can help bone density. So it's fun to have access to all this information and to help people kind of pick and choose what they might do for their health. But the struggle is the time to do it, right? Like I can give all this information and then it's a lot to change your lifestyle with all these things.
Yeah. And we are fortunate just in people are pretty understanding of me doing blood flow restriction training, or I'll even wear them at the gym sometimes. I usually use them more as a novelty. I'm usually showing it to somebody because everybody I've showed it to loves it.
Yeah.
And it's kind of fun to do with somebody, but we just kind of have, everybody's pretty understanding of doing it. And the people that I'm around kind of cater to that lifestyle. Like it's not weird to get into an ice bath or invite your friends to do that, as opposed to if you're totally outside of that and people don't understand it, it can be a little bit more of an obstacle, but I think that's just mental.
Yeah. Yeah.
So with the blood flow restriction training, that was coming off of the topic of hormones. Does that, I know about it for the bone density, the sarcopenia, which is muscle loss with age, right? But does that have any relation to hormones?
I'm just getting into research with it because I'm fascinated by how it affected me. And one of my friends, it's really helping her post-surgery arthritis, knee range of motion and strength improvement. So limited under knowledge of the research right now. It's more something that I'm I love getting into all these different gadgets and devices and tools and stuff. So I'm excited to see if I can get some people doing it consistently and start measuring hormones. I think that'd be really great.
Yeah, because I don't know. I just wouldn't be shocked if it has to do with growth hormone a little bit.
So
And
there is research on improvements in growth hormone. I don't know how often you'd have to do it to see some hormone profile changes. That's what I think. That's what I like to be able to say is, hey, I had 10 patients do this twice a week and their testosterone improved by, 30 to 40%. I like being able to have that reference point. And I just don't have that right now, but I think it's something that is affordable for a lot of people, and they can do it at home pretty easy with minimal training.
yeah, and I always recommend it. Like if you have any sort of injury, it's perfect too, because you can, with a 5-pound weight, get like a total
Right.
arm, shoulder workout, or with 0 weights on the legs, you just have to do lunges or squats or something, or step
Yeah.
ups, like you said.
Yeah.
Were you using the Katsu one?
I was using the hot grips.
Does that have the moderation, like the valves connected and it has a pump going and that kind of stuff? Okay.
Mhm.
I've never heard of that one, but yeah, I was going to say, you got to do the Katsu was the only one that I knew that did that, but with those pumps in there, that makes a big difference, because you can do it
Yeah.
for like 20 minutes,
Yeah.
or
Yeah.
Dr. McCullough said indefinitely, which I don't know
Yeah.
if I take a medical for that.
This chiropractor likes that one because they're a little bit narrower. So
Sure.
if they're too wide, you can apparently get some muscle atrophy under them. Which
Huh.
my friend actually noticed that she develops muscle really easy. Pretty much just doing push-ups, so she actually had a little atrophy under the band when she was working on her leg really heavily.
How often was she using them?
I'm not sure, but she was doing it quite a bit. So, but still, she got so much improvement from it, regardless of that anyway. So, we're going to learn a lot about all these new gadgets with the years come, but if these things are safe in general, you're probably not going to mess yourself up too much, versus doing a bunch of toxic stuff to yourself.
Yeah, the BFR seems pretty safe.
Yeah.
And a lot of this stuff does.
Yeah.
So I've been getting in a little bit more, or I shouldn't say getting into, but more intrigued increasingly with, like, you call it botanicals, but just like herbal medications. I don't know, what are some of your go-to? It probably depends on the indication or the issue that you're looking
I can
at,
give
but
you
what are some of the popular ones that you
Yeah,
use?
some of my favorites. Well, I always make sure that people are buying from companies that do third-party testing. So, and Amazon can have counterfeit stuff. So just
Yeah.
companies that do third-party testing, making sure that what's in the label is in the bottle. So, and then, working with a provider to help get you started. So you're using the right forms of things, because it depends. So with botanical medicine, it depends what part of the plant you're harvesting, what time of the year, how it was processed, all of these things, right? So you might get some echinacea from a Walgreens drugstore, and then you're like, it didn't work, but it was probably complete garbage. So you want to make sure if you're trying these things, to do effective treatments. But some of my favorite would be things like adrenal support. So whether or not people believe adrenal fatigue exists or not, almost all of my patients feel better taking some kind of adrenal support. So various botanicals help with your adrenal glands, but things like holy basil, ashwagandha, rhodiola, glandular adrenals from animal source. Let's see, what else do I really like? Ginseng can be helpful. So I tell people adrenal support's basically, for me, I tell people it's like a bubble between me and other people. So I'm less reactive to stressors. Things kind of bounce off me easier, and it's sort of a calm energy. So that's probably one of my favorite. There's a lot of amazing botanicals to help sleep. So I like that. So different sleep formulas by companies that I really like. Things like passion flower, kava.
Just ordered some kava. I'm interested in trying it.
Yeah.
Somebody So I didn't really know about kratom until recently, and I went to Scottsdale, and somebody's like, "Hey, I noticed you don't drink. I picked these up for you," and he gave me a couple of these shooters. And then I was like, "Oh, I felt kind of relaxed. So I'll order some." I ordered some, and then found out it's like this highly addictive drug.
Yeah, yeah, yeah. I
I
don't,
was
I don't, I don't recommend that.
like, no, I was like, okay, not all plants are good. We know this, but
Well,
I
yeah,
should have
and
looked into this a little bit more.
right. I mean, Coca-Cola used to have cocaine in it, right? That's where that term came from. And then, yeah, so we have a lot of addictive plants, a lot of toxic plants. So you have to know what you're doing. And just because it's so-called natural doesn't mean it's
Good for you.
good to be doing.
Yeah.
Yeah.
But on the topic of herbals too, one of the best kept secrets is Jane Barlow. Do you know Barlow Herbal?
Mm-mm. Oh,
Okay,
yeah, Barlow, they do like, I have like an intestinal formula, I think.
Limation and
Yeah.
yeah, ton of, but you can actually, it's barlowherbal.com. Like, go there, call the phone number, and talk to her. And her dad was like the one that started the company. She
Oh, nice.
worked with them all along, but they actually do a lot of getting their herbs in the wild too. So
Yeah.
they're harvesting seasonally, getting it wild, doing all
Well
that good
crafted,
stuff.
yeah.
And I'm
Yeah,
not sure about all of them, but the Lomation they are.
yeah, there's a lot of, there's many companies like that. So, like I used to be a student rep for Wise Woman Herbals, and they use a lot of wild crafted herbs, and they're in Oregon. There's Earth's Botanical Harvest. There's a whole bunch of companies like that. It's just those companies aren't necessarily always doing all this marketing, right? So that's where, if we're seeing, I mean, lately I'm having patients ask me about things and bringing in things, and it's like, oh, well, this is what they were telling me to take, and it ends up being Instagram ads, right? So it's hard to keep up with all the information that's getting marketed to patients. And they're often spending way more money for something like some growth hormone support supplement. It's just a combination of amino acids that instead of spending $90 for fancy packaging, they could be getting $25 at my office. And so I love helping people just spend less money on more effective things.
So the supplement industry is so tough, but then at the same time, you don't want like the FDA regulating it, because then it's just going to turn into the same problem with the medical devices.
I think it comes to just patient education of,
Yeah.
Like in binders and fillers on the supplement products, like, and does it have food coloring in there? Does it have high fructose corn syrup in there? Then don't get it, right? So
yeah, that's a bad company.
Yeah.
Exactly. Yeah, I know. I always see like I don't think this is always the case, but it's definitely a flag for me to like consider, is if there's like really expensive packaging, really nice bottling, everything is done perfectly, the marketing is just like really top notch. Most of your money is going to the marketing.
Yeah.
So then I start to wonder about the quality of the product. And I'm not saying that applies all the time, because there are people that run really good businesses that have great marketing and great products too. But I think that is like a flag for me that I'm kind of considering, because if you're buying a $70 bottle and say they're making it for $30, well, they're not going to have much room for like really high-end marketing.
Yeah.
And if they're making it for $30, it's probably a higher quality product. I know that's kind of bad rule of thumb, but
in general, yeah. I mean, often it's the smallest, fanciest looking bottle that costs the most for like facial care for women, right? It's like, wow, you just spent like $200 on this little tiny bottle, but it looks really cool. And then that same stuff is $40 in this size that's better quality, So, but yeah, I mean, marketing works. That's why it's out there.
Well, it is really interesting, because I've had the opportunity to study marketing a bit, just to make my business at least operate. And then I kind of quit studying it, but it's still interesting. So like price is the biggest thing we use to identify quality, because like, say you don't really know anything about TVs. And so like, you don't know like the back end, the wiring, like how it works and how the display actually works and how everything actually works. So for you to say it is worth this much, you have no idea, because you don't know what any of that means. And so for you to go in and like shop for a TV, the biggest predictor that you use of the quality is the price. So you look at, okay, that one's 1,500, that one's 500. I'm not the person that's going to spend top dollar. I'm also not going to get the crap. So I'm going to get the $1,000 one.
Mm-hmm.
And that's like what we use as a barometer for quality on like
Yeah.
95% of the stuff that we buy. Because we have no, like, I understand ozone generators really well and the value of construction there, but almost nothing else do I understand as well in terms of being able to determine its value.
Mm-hmm.
So I think that's just something to be aware of that we just tend to do. We just don't have any context to think otherwise, really, on stuff that we don't understand.
And I guess that's so for finding doctors and quality treatments. I guess it goes back to like gauge how you feel, right? So I usually tell people, hey, if you're taking this botanical treatment for hot flashes and night sweats, they should be 50% less in a week. Let me know if they're not. So I give them very specific outcomes because I've been doing it long enough. I can do that. And I've been using the things I recommend for a long enough time, most of them. So I think if you have some measurable outcomes, you could know what to expect. So that helps your purchasing dollars, right? Like, okay, I'm going to continue this because I had a 50% reduction in hot flashes and night sweats. Buying a TV is harder. I have no care in the world about the quality of the screen, the size of the TV. That's just not what I'm interested in. So I probably would buy the $500 one because I don't care about that.
But there's something else you might do that with.
But right, exactly. So it affects us all the time. Yeah.
There was this interesting social study done where they had a group of people doing wine tasting, right? And so they would bring the wine in the room and give it to them. And they did it with multiple wines. And the only thing they would tell them about the wine is the price of the wine. And so they had, you can kind of see where it's going, but they had like, 6 different prices on there. And it lined up to where it was all the same wine, by the way.
That's awesome.
But it lined up to, and then they would serve them like, how was the quality of the wine? How was it taste? And it like matched up identically with what they were told the price was. So the most expensive wine tasted the best, had the best body, whatever it is with wine. Yeah. And the cheapest one was the worst. It tasted like crap, all that kind of stuff. It was all the same wine. But it's really interesting, just the psychology in that. So I would say too, like if spending money, like, and you're getting the results you want makes you feel better, like just from even a psychological standpoint, then I don't have a problem with that. But I think the nice thing is that you can understand, like, there are ways to get things less expensive that are going to be equal or higher quality, and I think a lot of these like franchises and different things are starting to pop up for our industry. I don't know if they have been in Portland, but it's basically like fast food of medicine, like integrative care. And
well, I have one woman who had seen me and then she moved to the coast, so I hadn't seen her for a couple of years, and she found some health coach online who ordered some labs for them. And I don't quite know how that works, but I guess some labs you don't have to have a license to order the labs. But so she paid too much money for too many labs she didn't need, was put on some hormone creams. So by the time she saw me again 2 years later, her hormones were so messed up. And it was such a slow process of her feeling worse and worse and worse that she didn't quite realize it was the hormones she was taking. And so we got her back on track pretty fast, but it is kind of a danger of you Google search and you find not very educated people recommending some things, which is unfortunate. On the flip side, it's great for raised awareness, but maybe not the best guidance. I was thinking of, for money stuff. So I was treating this, I have a lot of Intel and Nike patients, just because I'm in Oregon, right? And there's 2 big employee centers here. So this executive from Intel, making an obscene amount of money per year, he had some ankle pain running, and he wanted to be able to run as fast as he likes to run. He's a really good athlete. So I said, well, we can start with doing some prolozone injections, and we can do some ozone IVs. And if you're not responding, we can add some PRP. And then if you're not responding to that, we can add some like exosomes, fetal stem cells, stuff like that. and he's like, and I talked about the cost of different things, and I said, so why don't we start here, and he's like, no, I want to do all of it now. And I struggle with that because I said, well, but what if this is all you needed? And he's like, I don't care. I want to feel better faster. So I can appreciate that. I can appreciate feeling better faster. But I tell all of my patients the same, whether you're an exec at Intel or you're a stay-at-home mom, I don't care. Here's the progression of treatments I'd recommend, and here's the prices. I'd recommend starting here. And I feel like maybe in healthcare, people aren't getting that understanding of, hey, you could start here and move up the line. And sometimes they're being told to start here.
Yeah, like with surgery.
Right? Or really expensive treatments that are offered at some of the conferences we go to, really expensive treatments that they don't need to do. So I think that's unfortunate too. But yeah, surgery should be last resort, right? If possible.
Yeah, well, yeah, it's super invasive too. And a lot of times you can find other stuff that is helpful. I'm not saying all cases, but I can also relate to that a little bit in terms of just like time savings. Like, because in my mind, I'd be like, okay, coming back here 6 times is going to be X amount of hours. So if I can just shortcut all that and like, it kind of makes sense. But so are you thinking of it like for him, like say he had $40 million, so he doesn't care if he spends an extra 10,000. Are you trying to save him money, or do you see that as like an actual helpful progression for his healthcare?
Well, I think the education piece is important. So, because now what if he thinks fetal stem cells is what fixed my ankle, but really it was ozone, right? So it's also an education piece of, I want people to know how powerful each tool is and what works the best for them. So down the road, they know, hey, this really helped me in this way. This is what I'd like to start with. So, and I don't care what someone's income is, like it's choose to spend the money if you want to, but what if you don't have to, right? Like spend it on something else. So, and just knowing like, okay, I know when I do ozone therapy, this is how I feel. When I do the hyperbaric oxygen chamber, this is how I feel. Now I know how to navigate what treatment I'm going to go forward with. So I think it's an educational thing too, but yeah, time saving is important. Yeah.
I think that's fair though. I mean, I think, having, I don't know, more of an intimacy with your injuries or your sickness and that kind of thing is like kind of teaches you how to prevent it in the future, or maybe even solve it again in the future. So I think that is a super important part of it.
Yeah.
So where can people find out about you, or if they want to potentially work with you? Do you do online stuff?
Yeah, so we can do telehealth. There's some, rules to that, but we can do telehealth. I'm in Oregon, Lake Oswego Health Center. And then we have a second clinic, Modern Radiance, Oregon. So that one we have hyperbaric oxygen chamber and some other anti-aging things. But Lake Oswego Health Center is my main clinic in Lake Oswego, Oregon. So appropriately named. So it's lakeoswegohealth.com. And the woman who schedules new patients, she's fabulous. So people can email, this is what's going on. This is what's going on. Is this something Dr. McMonagle or other doctors in her office can treat? Or would she recommend going somewhere else? So we do that all the time. Yeah.
Awesome. And what's your website?
lakeoswegohealth.com.
I might have missed that, but
yeah,
I think I stayed a couple days, like 10 minutes away from Lake Oswego. Might have been late last year, but next time I'm in the area, I'll stop by.
For sure, you should. Yes, that would be fun to see you. How's family doing?
Doing great. Yeah. Doing well.
Nice.
Down in Florida for a little bit here, so just hanging out, and the kids have been really active, and I'm a little bit more active now that it's sunny out and all that stuff. So it's been good. But I really appreciate you joining with us today. It's been awesome. Thank you so much.
Yeah, take care.